Good evening.
Good evening, everybody. Um, Thank you all for joining us this evening. For the benefit of those who don't know the National HRD Network, let me just give you a half-minute introduction. So the National HRD Network has been around since 1986, and it's an association for HR professionals. It's a forum really for growth and learning. And we get together at a chapter level, at a national level, for panel discussions or conferences to learn, from and with each other. Mind Matters is the mental health initiative of National HRD Network, and it was born from the acute anxieties of the pandemic, really, in 2020. And since then, we've had a series of panel discussions and workshops around mental health. The whole foundation of the Mind Matters initiative has been with the intention of normalizing conversations around mental health. And so it's around talking about things that we don't normally talk about. So this year, for example, since October 22, our theme has been addressing of taboo topics. So we've addressed domestic violence, men's mental health, body shaming, terminal illness and its impact on mental health. Now we're going to be talking about menopause and andropause today. Our future topics are going to be around layoffs, because that's what, that's hot at the moment, and its impact on mental health. We're going to talk about gaslighting in future panel discussions. And we're planning a big mental health conference at an annual basis, but the first one we're planning in September. So news on all that will be coming up for all of you if you're on our database. Let me introduce myself. My name is Devika Dharmaraj. I've been associated with National HRD Network for longer than I care to remember, and was part of the Mind Matters initiative since its inception. So we have a great team back end who has been, sort of putting their shoulder to the wheel for the last 2 or 3 years on making these panel discussions happen. A little bit of context setting for today. We're going to be talking about menopause and andropause. I know some of you may not even know what is andropause. We had to research it actually. And what its impact on mental health could be. Yeah, what happens? Is there anything we can do to support ourselves? What to do to support other people? What can organizations do about this? Yeah, and it is my great privilege to introduce our extremely exciting panelists today. We have Kate Usher, who is, could we have the spotlight on Kate, please? She's an experienced menopause coach and a gender equity consultant based out of the UK. She works with women and organizations, basically, to create strategies that enable conversations around menopause. Yeah. And these conversations ensure that most women retain their careers and that organizations continue to benefit from them. In addition to this, she's had about a 20-year career, Kate, in organizations which are FTSE 100 organizations, really, as a global project manager, managing global teams across continents. She's worked with organizations that are well known like Unilever, Tate & Lyle, Rio Tinto, but right now she's focused on the cause, the menopause cause, so to speak. Published author, internationally published author. Her book is called Your Second Phase: Reclaiming Work and Relationships During and After Menopause. This was shortlisted for the Business Book of the Year award So welcome, Kate. We are so happy to have you this evening and hoping to learn a lot.
Oh, it's an absolute pleasure to be here. Thank you so much for inviting me.
To balance out the menopause information and insights that we get from Kate, we have Dr. Varun Chandra Alur, who is a doctor with a specialization in endocrinology. He's a consultant endocrinologist at JJM Medical College and Alur Hospital in Davangere. With his qualifications, he's obviously a member of various, national, international professional bodies in his profession. He's got several international publications to his credit and about 10 years of clinical experience where he works with undergrad and postgrad students as well. Yeah. Just a little bit about his profession. I think, for those of you who are not aware, endocrinology is really the study of hormones. And there are hundreds of millions of people, I think, worldwide who suffer from diseases and conditions tied to hormone disturbances. Yeah. In many of these cases, the medical professional endocrinologists really are the unsung heroes. And they're the ones who see the pattern in a bunch of often unique symptoms or seemingly unconnected symptoms. And many of the medical breakthroughs really, like the discovery of insulin apparently, has been attributed to people like Dr. Varun, to endocrinologists. So when we asked him for a little bit of, to tell us a little bit about himself, to introduce him, he has been so humble. He's diverged very little information about himself, but whatever I've seen online about him, he's very well respected in his field. So we're very pleased to have you and eager to learn a little bit about an area that none of us know anything about, which is andropause. Thank you so much for joining us, Dr. Varun. Could we have Dr. Varun and Kate on spotlight, please? Thank you. And last but definitely not the least, we've got Indranil Mukherjee, who is a veteran in the healthcare industry. He's had about 3 decades. Indranil doesn't look like you've had 30 years of experience. You look far too young for that, in the med tech industry as well as pharmaceuticals. He's currently the group CEO for a leading vascular MNC called Translumina Therapeutics, and he's based out of Delhi. Indranil has had a lot of experience in sales, marketing, business development, operations at all levels, local, regional, global levels, and has served on the board of Medical Technology Association of India. He's also been the ex-chairman of the European Business Group Healthcare Sector Committee. So a number of committees that he's been on in the medtech field internationally as well. But more relevant for us, he's been at the forefront of diversity and inclusion initiatives across the organizations that he's been with. And we are waiting to hear from you, Indranil, your insights on how we can address issues around this topic in organizations. So thank you for joining us.
Thank you. Pleasure for being invited.
Thank you. 1 second. I don't know what's going on with the spotlight. I'm just adding them again. Hang on. Okay. Okay. There'll be all 4 of us will be spotlighted through the session today. Okay, just to let you all know. So let me start with Kate. Kate, could you help our audience to understand, just starting at foundation level, because there will be many people here who don't know about menopause. So just what is menopause, and why are we talking about it today? How does it impact mental health at all? What does it look like? What does it feel like? Yeah.
Okay, so we talk about menopause as the whole thing, but actually menopause has three distinct phases. So it has perimenopause, and that's the bit around. Peri just means around, so it's the bit as you lead into your menopause when you're starting to experience those tricky symptoms. Then menopause itself is 12 months since your last period. And then once you've been through that 12 months, then you move into your postmenopause, which is where you remain for the rest of your life. So because of the nature of menopause and variable periods, etc., it means that you can go for numerous months without having a period. In fact, you can go for 11 months. It's very frustrating until you go through that 12-month gate, that full 12 months. Then you can't say you've been through your menopause and moving into your postmenopausal phase.
Okay.
So why is it tricky? Why do we find it uncomfortable to talk about it? What does it feel like? Those are the questions around this.
Well, in India, Kate, I think just talking about periods is extremely uncomfortable socially, definitely for men and for a lot of women as well. So that's the first taboo that we need to, I think, break by normalizing conversations around that itself, about menstruation itself.
Absolutely. So if you're finding it difficult to talk about something that women experience for what, let's say 30 years, or probably longer, maybe 40 years, it then becomes incredibly difficult to talk about menopause at the other end of it.
Yeah.
Of course, menopause is completely natural, just like periods are, unless you have a medical menopause, and that means that you have something like an oophorectomy, so a full hysterectomy. You take out the ovaries as well. Then you would go directly into menopause at that moment, or due to some medical treatments like cancer treatments, etc.
Or those precipitated, is it?
Yeah. So if it depends what it is, some treatments take you into a medical menopause. Some it's temporary. So for things like endometriosis, it can be a temporary treatment. But for some, obviously, especially if you've had a oophorectomy, then it's permanent. So when does it happen? It happens for most women in India somewhere between the early 40s through to your early 50s. So if you take that 10-year period, then you can start to understand why this is such a big issue for women, because it's occurring in their power years as far as their career is concerned, when they're starting to focus, they've had their children and they're starting to focus on doing other things with their lives, maybe more than just staying at home and being a home carer, home giver. So they're starting to expand their ideas. Maybe they're starting a new business and things like that. And that's very common in this phase of life. And if you think that there are over 40 symptoms involved in this, and they cover the whole sphere of our lives. So they range from the things like hot flushes and night sweats and variable periods and mood swings. And that can be from bursting into tears for no reason at all to being extremely angry. It's a real sort of deep rage that women experience. And it can be very, very confusing, not just for women, but for everybody they interact with, because suddenly relationships are about, I turn up in this way, you turn up in that way, and we know how we're going to behave. And then suddenly I turn up in a completely different way and I'm behaving utterly differently. And therefore, as people are interacting with me, it can be very difficult indeed and confusing. So,
Kate, are you saying that this kind of thing can last for up to 10 years for women?
Yes. In fact, it can last for over 10 years. So it's not unusual for me to speak to women who are in excess of 10 years. The NHS in the UK is saying that it's somewhere between 4 to 8 years. And generally, they're kind of thinking the perimenopause lasts for 4 years, but it's very, very movable.
What is peri? Peri is before, is it?
peri is before. It's the bit around. So it's the time when you start to experience those tricky symptoms.
Okay.
So as far as relationships are concerned, so at home, there are numerous symptoms which are very difficult for women to talk about. And I'm sure in India, they would be extremely difficult for women to talk about. And we're talking about some of the ones that interfere with intimacy. So vaginal dryness, things like that, repeated UTIs, repeated thrush, incontinence. These are very difficult conversations, even for the most enlightened woman. They're very difficult conversations to have. And it can feel at times like you've done something wrong. And that's not the case. This is about, and Dr.
These are very private things, isn't it? These are very personal and private things. You don't want to talk about this even to your near and dear.
No. And if you've not had that sort of, we have this belief that these conversations about how to talk about these things and how to even to talk amongst women, those conversations are kind of passed generationally down. But this part of our sort of generational conversation tends to be missed out.
Yeah.
We don't talk about this because it's really uncomfortable, but it's a natural part of our lives, and it goes on for so long that it's now becoming a bigger issue because more of us are going through this, more of us are trying to do more with our lives. We've got careers, we've got other things going on, we've got elderly parents, we've got young children. All of that is now in the mix. And then you've got this going on as well, and it can be very difficult indeed. That's why we're starting to talk about this.
Thank you. And I can see how it impacts mental health as well. If all of these things are going on, it's not just a physical thing. It's like it's messing with my head and my concept of who I am, really.
Quite literally.
Yeah,
absolutely. So the estrogen sensors in your brain are extremely sensitive, and quite often the sort of anxiety and depression and panic attacks are the first symptoms to show up, because these sensors are far more sensitive than these sensors. Quite literally, your head is being messed with. So the other ones that we tend to see very commonly are forgetfulness. So it's called brain fog, but it feels more tricky than that. It feels scary. You think a lot of women wonder if they've got early onset Alzheimer's because they go to say something and
and that's the age that Alzheimer's sometimes starts as well.
Yeah, no, so women are scared.
That's scary.
But this is a natural part of menopause, that kind of loss of verbal recall, memory lapses. These are natural, and they are because we have an estrogen deficiency. And because of that, we need to look at how we can replace that estrogen. Thing is to feel as though there is a solution, there is an option, there are things that you can do, and not feel disempowered by this. It's not inevitable that you will be heading down a certain direction that you feel is uncomfortable or that you can't cope. There are solutions and there are things that you can do. But the first step along that is absolutely to be able to say, I need help. And
thank you, Kate. That's throwing a little bit of light for those who, this is a new topic too. I'm gonna take it to Dr. Varun now, to ask, all these hormonal changes that Kate was talking about. I'm sure it happens for men also, right? Because we all go through this through our teens when we're going into adulthood. So as we're going older, I'm sure it is not only women that have hormonal changes. I'm sure men do too. But what I've heard is that it's the pattern and the how it manifests is very distinct from women. So there is apparently in recent years there's been quite a lot of evidence to show that andropause is a medically definable condition. So can you talk to us a little bit about, do men go through any bodily changes? Does it impact them in similar ways? Does it have, like, obviously from what Kate was saying, for women, and I know this because I'm in the throes of menopause myself, I know it's affecting my daily functioning. I do not have the energy or my brain cells are not firing like they used to even a few years ago. This brain fog is happening fairly often for me.
Yeah.
And it is a scary thing. So does it affect men similarly? Is it visible? Is it disabling? Is there a mental health impact?
Yes, Devika, thank you for being me here, and I thank all the team here. So yes, definitely, as we just now were discussing, even as Kate mentioned. So menopause, as menopause happens, but andropause, usually it is not that sudden or severe or even that dramatic, as we can call it. It doesn't happen in a certain period of time. So that's why there are many other nomenclatures for andropause, something like late onset hypogonadism, or even decreased testosterone levels. So many other nomenclatures.
Is that the same thing though? Is it because of
Yeah.
decreased testosterone that this happens?
Exactly. So it decreased testosterone over a period of time. So physiologically, it doesn't happen just like in women where menopause occurs between age of 40 to 50 or 45 to 55. So in men, usually in studies, what it has been recorded, it is after 40 years, every year there will be 1% reduction of testosterone. So that is considered as physiological. But anything beyond that, we do consider it as an abnormal or a pathological condition. So what are the patients, or how does a patient with loss of testosterone levels or hypogonadism or late onset hypogonadism look like? So usually, as you mentioned, definitely it does have a predominant role on the mental health impact as well. And since it is not going to have any predominant symptoms like attached to the hypogonadism, they might have many of these routine or the generalized symptoms, which may not be able to pinpoint as hypogonadism or late onset hypogonadism or even andropause for that matter. So what can they have? Usually they can have at the initial levels, they can have reduced sex drive or sexual drive. They can also have decreased spontaneous erections. So loss of early morning erections is the number one pinpointing reason for low testosterone levels. Even sometimes breast discomfort or body fat accumulation itself. So the way the person feels that body fat has been redistributed and it is accumulating in different places. Infertility, yes, definitely.
So this is why middle-aged men are generally, start putting on weight, or we think they're putting on weight, and they look a little stockier than they did before.
Yeah, maybe that may be associated with their lifestyle and obesity and diabetes and all those metabolic risk factors as well. So in not only that, even they can also have some of these fragility fractures, some of the psychosomatic features such as loss of memory, as just now we were discussing. Again, they can have lethargy, they can have mood swings as well. Even some have also pointed as hot flushes or even night sweats. So definitely they have also got wide variety of symptoms. But thing is, we cannot pinpoint at this one point of time or during one period or years where they can experience such an episode. So, and the symptoms as well are also very subtle. Instead, wherein menopausal symptoms have very clear cut, or at least they'll have we can expect at certain point of time. And there are many reasons as well why they undergo such a loss of loss of hypogonadism or andropause. So many times they may be taking so many drugs for many other diseases as well. So those affect their all these reduction in testosterone levels. And not only that, even sometimes the loss of reduced exercise, reduced obesity, increase in obesity, increase in the truncal fat, or as we call it as thin fat Indian, where the legs and the thighs, till that is they are very lean, whereas the abdominal part they will put up a lot of fat. So we call it typically as a thin fat Indian. So all these factors they can bring in, and it can also lead to catastrophic issues such as fragility fractures, meaning even with just a trivial fall, a trivial injury can lead into a major fracture. So that can be there.
Oh, it affects the bones, is it? Density?
Yeah, exactly. So they can have osteoporosis. So
Okay. For women also, I think, isn't it, Kate? Yeah. Okay.
Yeah. So they can have osteoporosis and fragility fractures if they lose testosterone levels. So in these factors, so definitely it affects a wide variety of organ systems in our body.
Okay. What about the mental health, Dr. Varun? I mean, are they more prone to depression at certain points in this journey? At what points?
Yes, absolutely. So whenever they're feeling all such symptoms, so when loss of muscle mass, when they are not able to do the activities in the similar manner which they used to do quite some time back. So definitely, depression is very well known in patients who have got undergone andropause or testosterone levels.
And it is so vividly visible in what percentage of men? I mean, just for us to get an idea, do most men have this? Because not all women say that they have distinct menopausal symptoms, right? So how is it for men then?
Yeah, the problem with the andropause or even the reduced testosterone levels in men. So it, as I mentioned, it doesn't have typical symptoms as the menopause or when they stop having cycles and then they come. So they don't have all these symptoms. So one, for that reason, so they don't come up, or they're always subclinical or just below the tip of the iceberg. So even though as it is already known as a taboo topic, so there are not many other studies are also not there that to know the exact prevalence of at what age group, how many people are suffering from such a condition. So, but definitely it is prevalent. And many of people who are working day to day and with the stress and the reduced exercise and obesity, yes, and is a real problem which we need to look into more deeper.
Is it only your specialization, endocrinology, that really connects these dots and puts it together? Can a GP, will a GP be able to tell them that this is why you're feeling like this?
Yes, absolutely. So I think a patient with an andropause or reduced testosterone levels can go to many other specialties, either in terms of a general physician or a physician itself, or an orthopedician who might have some bones pains and all those such things. They can also reach out with some fragility fractures. They can also reach out to the psychologist that he might be feeling depressed. So they also reach out to some of the dermatologists, so their skin may be lost, or a skin turgor may be lost, or loss of muscle mass. So I don't think it is just a single specialty thing. They can reach out to many other specialties as well.
Thank you so much, Dr. Varun. So let's look at how these things affect us, as individuals and at work as well. Okay. Indranil, can you tell us, in your experience, do these signs and symptoms that we've talked about so far, do they impact the workplace at all, or does it not matter at all from an organizational context? How do organizations react to this? Are they impacted at all? If you can tell us from that perspective, please.
Yeah. So first and foremost, thanks, Devika, and as well, Kate and Dr. Varun. I think when we are talking about it as a taboo topic, I would rather say even andropause is a taboo topic, because, I mean, be it India, the Oriental culture, or even in the West, men have this macho image which has been built up. As children, when we grow up, boys are not supposed to cry. So that's the kind of, let's say, societal pressure that builds up. So the very admission of something going wrong with the hormones, is something which men are brought up or conditioned not to admit. So andropause is not even
especially when it threatens your libido or your
Absolutely.
testosterone drive, isn't it?
Yes, yes. Now we can't, unfortunately, change societal behaviors. But now, from an organization, what I've seen, and it's very interesting, because let's start with, does it affect the organization? It does. And for any organization, employees contribute their best when they bring in, of course, knowledge and skill sets, but more importantly, the experience that they accumulate over the years. And this experience then manifested with the knowledge that they bring in, the skill sets that they have developed. This is really very productive after putting in, let's say, about 10 years plus of experience. That's when you get to kind of apply this knowledge, apply those skill sets, and grow professionally, as well as help the organization to grow. So for an organization, when employees are in that age bracket of, I would say 35 plus until 50, it's when the employees can really contribute at their peak. And that's where then are organizations sensitive or cognitive of that fact? Unfortunately, the answer is no, not yet. Of course, in the recent past, there has been a lot of clamor about diversity and inclusion. This is when,
Sorry.
So me in my early 50s, did I notice andropause? Not really. When I reflect back, then of course, yes, I do. When my wife underwent menopause, and these are trying times in the family, because children growing up, dealing with a rebellious teen at that moment in life, the pressures of the corporate world, and then of course your own individual problems. So from an organization point of view, there is still a long way to go. It can't be only the prerogative of HR. Of course, HR definitely needs to take the lead to sensitize everyone, educate everyone. And I think it also falls, especially when it comes to menopause, which is more at least recognized. Andropause is still in the closet. But from a topic like menopause, the very fact that it is something very normal and as a part of our body health, this topic needs to be ingrained first to start with women as well, right? So women also need to kind of, be a little bit more courageous and not look at it with a sense of a guilt or a sense of a shame. Normally, this suffer in silence does not really help. So reaching out is the first thing to do. And that's where organizations then also, so it always takes two to come together. So when we do that, then of course it makes, improves productivity and efficiency. Because what I keep on saying, and something which I believe very honestly, is diversity is a fact. You can, whether you believe it or not, when you lead teams, people across geographies, you're dealing with different generations of people, the baby boomers to millennials, the Gen X, Gen Ys, and so on. Color, gender, caste, whatever it is, diversity is a fact. You can't say that I don't believe in diversity. What's more important is the whole part about inclusion is more a behavioral aspect. So that's where organizations, which are, let's say, a collective of individuals, need to look internally in terms of how does the organization behave and what is set up as a culture. So I think it's more a culture topic. And then, of course, these topics can.
In fact, this year's Women's Day thing yesterday was embrace equity, right?
Right.
So when you're saying equity, propose this kind of topic, what would it look like? What does that mean? Equity where?
So in the workplace, I have always encouraged many of my women colleagues to also professionally grow in their career. But what I make it very clear, and it shouldn't just be that there has to be an automatic reservation at the board or at the C-suite. It should be more about equality in terms of opportunities. And it should be more about cerebral equality. It shouldn't just be like this whole reservation topic that we have, because then that delves into a different space. And yes, there, as we are addressing this topic, especially for women colleagues who then are in this phase of 40 plus or 45 plus, we do, of course, see those mood swings, as we call it, in the office. And like Dr. Varun said, men also go through that, but not so dramatic like women. And that's where I said it starts with all what the organization needs to do. So from my experience, which I've been able to address this for the last 4 to 5 years in 2 organizations that I worked with, is first and foremost kind of not just this, but many taboo topics, bringing it out of the closet and, addressing it to everyone, making it everyone aware that this is normal. This is a part of health. So
that's part of the culture. That's the culture bit that you're talking about.
Yeah, we can't be a healthcare company and a medtech company if we ourselves develop reservations or inhibitions about it.
True. But what you said about cerebral, equality or opportunities, I'm already feeling a little bit on the back foot there, because if I'm, having this forgetfulness thing, this brain fog thing, this inability to keep all those balls in the air like I used to.
That's only temporary. But
I don't know that, and the organization doesn't know that either. So, then very often it's like, oh, this one is past her prime, and let's put her on the back bench, sort of thing. So that fear is very real, and I think a lot of women fall off the workforce in this phase of their lives because of these things happening, and a loss of self-esteem, loss of confidence in yourself, because you really don't think you're capable of doing this anymore, and you don't know that it's a temporary thing.
When we have kind of grown up with this adage that every crisis is an opportunity, I think COVID is the biggest manifestation of that. COVID dispels so many myths. We as healthcare companies could never imagine a work from home. We thought this was something more a privilege enjoyed by IT and not by us. But I think COVID, while it had a lot of those adversities, disruptions, wreaked havoc, caused a lot of loss, but it changed the way how we work and how we look at work. So yes, of course, coming to office, working in a certain fixed period of time, bonding with the team and blah, blah, it has all its advantages. But it has given, let's say, an acceptance to flexible working. And that's when we are addressing these kind of topics. That's what I said. It all depends in terms of what kind of organization culture do we want to build up. And very core of it is understanding the whole concept of flexible working. It also builds on a sense of, trust and transparency. You need to basically, so the very typical, even last week, I was having a discussion internally with my HR, and we were discussing on leave policy. And that's when I said that, is the leave policy really relevant right now? Because you got to trust people. You can't always, you got to accept and admit that you need to give space to people as much as we would want everybody to come to office, not depend on emails and virtual team meetings and Zoom calls and so on. But at the same time, we have to kind of get used to the fact, and especially when we are dealing with, let's say, someone going through a menopause, maybe a flexible timing during the morning, or someone taking a day off. That does not necessarily mean you keep on adjusting with sick leaves. So even
and not be judgmental about it.
Not being judgmental about it. So much of perceptive bias we built up and immediately jump into that. That's a zone that we should be careful about.
And how do you think, what can we do about it as individuals to change that culture and to remove the needle?
I think this is a fantastic platform when you're talking of the National HRD Network. As HR professionals, we need to together address this core concept of what is flexible working, right? And that's number one. Number two is not just this, but as I said, all these kind of so-called taboo topics, I think then it's a huge sense of responsibility on us to ensure that these are topics which are discussed openly within the organization. Unless and until everybody is educated about it, it won't make a difference. And that's how you would build empathy. You don't build up pity and a sympathy there. You build empathy. That's very important. And third is, of course, then, as I said, treat it as something which is a very normal part of health, whether it's with men or women, more with women as they go through it, but also with men, in terms of how our societies are built up, and fortunately that's changing right now, but still that's what. So these are some basic things at the workplace where, from a HR professional point of view, it's a great lever to act on individually in our organizations.
Yeah, thank you. Lots of work there, I think, not just for HR, but for everybody in the organization.
Right.
Yes. Thank you, Indranil. So if I could just hear from all three of you, a little bit about your opinions or your insights on what can we do about moving the needle on this as individuals, on two things. One is, if we are experiencing it or we know somebody who's experiencing it, what can we do as individuals to help ourselves or to help that person? Are there solutions? Are there ways to be
what's going on, because while it's a mystery, we've taken the power of choice away from us. So we've taken the power of action away from us. So the first things first is to make yourself aware of what menopause is. So how long it goes on for, what the symptoms are, and the fact that every single woman will have one. 25% of us will have a terrible time of it, 50% of us will have some symptoms, and 25% will sail through. Now, we all want to be the 25% who sail through. Sadly, we can't. So make yourself aware of what this is, because once you understand what it is, then you will be able to make decisions about what support you might need, should you need to. Should you be in the 25% who are having a really tough time, or even in the 50% who just need some additional support. And there's been some questions in the chat there about what we could do for ourselves in that sort of perimenopause phase and the pre-perimenopause phase, if you like. So our early to mid 30s, what can we do? We can absolutely start to look after our well-being. We can look after our physicality. So do exercise, eat properly, drink water, take all the sugars and all the stimulants out of our diets, and generally look after ourselves. Stress is really complicated during menopause. Absolutely address that and deal with that far more. And understand that if your workplace is not talking about this, ask for your workplace to talk about this. This is not unique to you. Every single woman is going to face this. And because of that, and because of the nature of symptoms, every single man is going to experience it alongside you. So it's something that we all need to address. And as Indranil was saying, this is about awareness. It's about a HR department saying, absolutely, this is impacting our workforce. We want to keep these brilliant women on board, and we want to ensure that we keep them through that decade. And so that at the end of this, when it does pass, that they are doing fantastic things. So what can you do as a man if you're seeing that your colleague is suffering and is really, really struggling? Absolutely do not say, I think you're menopausal, because that is bound to really upset them. So what I would say is, this is not for you to solve. This is not for you to fix. And men like to fix things. This is part of their role. They kind of help us along. But this is not one of those things. This is about saying, I'm an ally. This is about saying, I will sit alongside you. I will, you know, if you're struggling and you want to pass it over to me in a meeting, absolutely, let's have a conversation about that. But if the woman isn't ready to talk to you, just be responsive in the sense that if they're struggling with hot flushes, go and get a drink of cold water. If they are, you know, having to leave the room unexpectedly for numerous issues, then absolutely say, I'll just pick up when, and you can pick up when you come back. Be
supportive, basically.
Yes.
And ask how can I help you, or how can I support you?
Absolutely.
Okay.
So all of those things, put those indicators out. That this is a culture within this organization that is accepting of this phase in life, that is accepting of women, that values women and wants women to stay in their workforce. Because if we start to step aside for all those reasons that you were saying, and I've experienced them too, sort of the memory issues, if you then step aside and don't continue with your career in the way that we need you to as communities and economies, etc., then absolutely this is a loss to everybody, and we have to address this. We can't lose your experience, your knowledge, your ability, connectedness, understanding, and your ability to mentor the younger people coming up through the organization because of this life phase.
Yeah. So we need to talk about it also a little more, right?
Yeah.
About our own issues in this, so that other women also are able to open up.
Absolutely. And start groups within your organization. You know, just women getting together and talking about it. They're incredibly successful, incredibly empowering, and it enables women to say, I'm really having a tough time. I just need some support.
Thank you, Kate. Thanks. Dr. Varun, any words of wisdom? Because there are a lot of questions in the chat about asking about medication and HRT, and, you know, is there medication that can, you know, help both menopause as well as in the case of andropause, and some insights into that, you know, medication and its benefits or side effects?
Yes, absolutely. See, first of all, as we just now previously discussed, it is not going to be having any pointers, so they might have specialized symptoms. So when they're going for a routine health checkup, so it is worthwhile to get these testosterone levels once in a while, at least a year or a 1.5 year once. If first thing. Second thing, if at all they are suffering from any other comorbid conditions, either diabetes, hypertension, heart disease, thyroid disorders. So conditions can also affect the testosterone levels. So definitely those medicines can be optimized according to the physician advice. Okay. And the third important point, so natural testosterone boosters. So I think you can look in on the web, so you can get a lot of these advices. Natural, I'm not talking about any of these supplements. I'm talking about natural testosterone boosters, either good sleep, good 8 hours sleep, that will help them.
Thank you for talking about these. I think
good so daily 45 minutes to 1 hour, at least 5 days a week or 4 days a week. Good cardio exercise, so definitely help. So good
lifestyle, you're saying.
Exactly. So good overall better lifestyle should also boost the testosterone levels. Definitely, if it is way beyond lower than in the treatable range, so then they have to consult their physician, and they can talk to them and do the testosterone levels once, not twice, so we can confirm it is low testosterone. And for therapy purpose, we have many types of therapy. There is testosterone injections available, creams available, as well as testosterone patches. So just like a patch which we can apply on our forearm or on the back. So all those things are definitely.
Women don't have any patches.
Yes, they have. We do get estrogen patches, gels, as well as injections, depot preparations as well. So again, plus and minus are always there. Whenever we are talking about HRT is always a big question. Especially in males, if you're talking, it is about prostate cancer or even breast cancer.
These are the risks, is it?
Yes, these are some of the risk factors with HRT in males. That is, all testosterone is given. If we can expect their hematocrit to increase, meaning their viscosity of the blood.
Is this why doctors are so hesitant to prescribe then
Exactly.
to people?
So,
Does this apply for women also, doctor?
Exactly. So it does apply to women as well. So something if at all we are taking the hormonal replacement therapy, so we have to be screened for the most common cancers, especially in females. It may be breast cancer as well as cervical cancer, and it is prostatic cancer and as well as breast cancer is very common with prolonged use, and they also have a high viscosity of the blood, both males and females. It can cause blockage of veins and even.
I see. Okay.
So,
So not to be prescribed lightly is basically what you're saying.
That even though if you are suffering from such a condition, you might not be, the treatment is not available widely, or it's always reserved for patients who definitely need it. In younger patients who might have, for various other reasons, their testosterone or the hormonal levels in females might have reduced, or they might, for various reasons, they have attained early menopause. So definitely, with thinking about all these things, then we have to think about HRT. So it is choosing between the two evils. So
okay, I just want to go back to Kate for a minute, Kate, because I know that HRTs made a comeback really in the UK, isn't it? They went through a phase of saying no, you shouldn't do it, and now it seems to have made a comeback. So what has made people more pro HRT now?
There's two things going on, really. Firstly, that there is a generation of women who want to continue with their career. They still want to achieve, and they still want to, keep building their pension, keeping on their lifestyle, supporting their families, and they don't want to step away from their careers. And they need some assistance to do that. So firstly, that's what's going on. Secondly, the study that came out over 20 years ago now that said that there was this huge link to breast cancer has been largely disproved. And there's been some advances in how HRT is made, and it's no longer made from pregnant horse wee. It is now made from yams, and so it's far more natural. And there are, just as Dr. Varun was saying, that we get creams and we get patches, and estrogen that's taken via the skin, so transdermal, carries the lowest risk, as does micronized progesterone, which if you've got your womb, you have to take a progesterone as well. And so the risks have been diminished. So they are small. To put it in some context, if you are obese, then your risk of gaining breast cancer is far higher than that through HRT. So you are making decisions for yourself. There is a risk. It is much smaller than it used to be, but nonetheless it is there. And you have to make a decision for you as an individual in each individual case. So we're seeing the risks have declined. Women have got more things at stake in their lives essentially now. So the sort of balance has changed.
Okay, thank you, Kate. So sorry to have interrupted you, Dr. Varun. Was there anything else you wanted to add to this?
Yeah, no, nothing much.
Yeah?
So
okay.
All modalities at this point.
There's there's a question that I don't know who to address this question to, that has come up on the chat. But there's a person who's a teacher and is requesting guidance for a 40 plus for teachers who are 40 plus going through this phase, and I have to handle teenagers who are themselves going through hormonal changes. So it's like both sides. I really feel for you, the person who has written this. So any words of advice for this person who's struggling, any of you?
I'm happy to
Yes,
take that. Teachers have a particularly hard time, they do in the UK and every other country I've ever spoken in. It is very difficult because you are standing in front of teenagers who, let's face it, can be pretty horrible at times. And you can't hide. There is nowhere to hide. So if you are struggling with specific symptoms, there's very little space for you to do anything. So this is about how you manage yourself in that space. So I'm not suggesting at all that you say, especially in your communities, say, I've got a menopausal symptom, or this is my menopause. But what I am saying is have some one-liners that you can use. So be able to say with control in your space of power and say, I'm just going to leave the room shortly. I'll be back in 1 minute. Instead of going, oh my goodness, I'm so hot, or I've got to go to the toilet now because I'm flooding. So something along those lines. If you have your one-liners, you practice them, you know what you're saying, you can go quickly. Equally, there's a lot of women in teaching around the world, and therefore, as a group of women, as a group of teachers, it is important that you have this conversation between you so that you can support each other. We're coming back to Indranil's comment about culture, awareness, conversations every single time.
Thank you, Kate. There's a slightly, we're running out of time, but I do want this one question, put this one question out there because it's a little tricky. And I also think it is something that we don't talk about. So, I'd like to bring it out there, which is, how does menopause or andropause work for trans people? What happens? Any doctor, would you be able to help us with this?
Transgender is a totally different ball game. So exactly, the transgender means they'll be having many of these hormonal abnormalities, where they'll be having the problem with the transgender is the hormonal abnormalities. The production of itself is increased. It's not the organ itself. So there is some gene changes in the production of actually the hormones come from testosterone, from cholesterol. They become testosterone or the estrogen, the male.
So when we're talking about mental health, since that is our the umbrella here, would it impact trans people more in terms of their mental health, do you think?
Yeah, more or less the same, I would say.
Okay.
They also go through.
All right. And at similar ages, or when they're doing the hormone replacement therapy?
Yeah. If they're on hormone replacement therapy, so for a long time or for whatever stipulated time, the hormone levels starts coming down. So they will have some of these
issues. Yeah. Okay. So thank you so much. I'm, just aware of the time, last couple of minutes. If you all have just a couple of sentences each that you would like to share with our audience before we close out. Indranil?
Yeah, I mean, of course, and thanks a lot to Kate and Dr. Varun for bringing out, very nicely the medical part of the management and what we can do. On a personal side, my only 2 cents would be, first and foremost, is build up a healthy self-esteem. Easy to say, difficult to practice, but it starts with us. Build up a healthy self-esteem. And when I say healthy self-esteem, the first thing is that what others think of you is none of your business. Yeah. So that does not mean be arrogant, be humble, but don't get so worried about what others think of you, no matter which phase of your life. Everybody has their own journey, right? So, I mean, that's number one. And number 2 is don't give others the privilege of making you happy or sad. You have your own hormones to deal with. So that's about it. Life is a short trip. Enjoy it. There are some days which are good, some days which are bad, but don't get so worked up about it. And that's about it.
Focus on being well then.
Yes,
thank you,
that's right. Thank you.
Kate?
Gosh, that's lovely. May I say that's just lovely. Right, okay, so what I would say is find out what menopause is, first and foremost. If you don't know what's happening to you, or you don't know what's coming, then it can be very frightening indeed. Understand what it is, find out what the symptoms are, find out what your choices are should you need to access them, and you will be prepared. And also talk to the people you love about what's going on, because they are not mind readers. They can't guess at what's going on for you. Absolutely talk to them, tell them what you need from them, tell them how you can work together to get to the other side of this intact, and have some fun along the way.
Thank you, Kate. That's good advice indeed. Thank you. Dr. Varun, last remark.
Yeah, so try to be active and try to boost your testosterone levels. Do have a checkup once in a while, and if needed, definitely approach for your physician for treatment, and definitely everything else can fit in place once you start doing that.
Thank you, Dr. Varun. And my big takeaway from what you said was also around lifestyle, you know, that one should look at lifestyle changes and wellness really to cope with these changes. Yeah. Thank you so much. Very informative. I've really enjoyed talking to you, and this 1 hour just flew. I have so much more to ask the three of you, but I think let's park that for another session. Yeah, part 2. We'll do a part 2 later with the three of you. Thank you so much, Indranil, Kate, and Dr. Varun.
Thank you.
Thank you.
Have a nice evening. Yeah.
Thank you for inviting me. Thank you.
Thank you.